Hello again. Welcome to another video on the Enough is Enough YouTube channel. This time it's a little bit different to the others. This video is quite a lot longer. It was actually the first one that we ever put together. It's a little bit rough around the edges. We did it very quickly. I just wanted to get the news out there. I was so excited at what I'd learned from Dr Chetty that I wanted to tell the world. So I wrote a whole manifesto, put it all down. And so I finally decided to put it on to our YouTube channel. You may find it helpful. It gives you the whole gamut of where I'm coming from. And so hopefully give you a lot to think about. And I've learned a little bit more about the medication since then. I think I majored on the antihistamines, but he actually uses a bit more steroid as well. But you'll get the idea. So I hope you get a lot out of it and hope to see you again next time. Good on you. Take care. Bye. Hello. And thank you for taking the time to watch and to listen to what I have to say. We live in very strange days indeed. I never thought that in my wildest dreams that I would ever be putting a YouTube video together to talk about the pandemic. I don't do social media except for a few economic forums. I can't even remember the last time I watched regular TV. But that's how bad I think things are. In fact, I think there's an urgency at the moment for not just myself, but as many as possible to speak up. I'm not a doctor, and I'm not a politician. I'm nobody special. I'm just a very, very concerned citizen. So concerned that I'm prepared to put myself out there, something that I would seriously rather not do. Because I believe that there is a perspective on the pandemic that you might find helpful. It might even change the way that you look at the whole thing. First up, I want to reassure you, I'm not here to push any specific medications. I'm not into conspiracy theories. And I'm not here to unduly attack or slander anyone. There are more than enough people all around the world on the internet doing that already. And I don't think it helps. I think it just makes things worse. It makes it harder for us to sort out what is true from what is someone's imagination. We live in the information age, but from what I can tell, a lot of it is actually misinformation. Also, I'm not an anti-vaxxer, but before I received my vaccinations, I did some research. I learned about how they basically worked and what the risks are, and there are risks. Make no mistake, there have been deaths and some serious side effects as a result of our worldwide vaccination rollout. As a result, I am very sympathetic to anyone who has decided not to be vaccinated. I totally respect their decision. After all, if there are long-term health problems that come down the track because of the vaccines, shouldn't we at least have some people in our population who have not been impacted by them? Now, most importantly, before I begin, I would like to address a few issues because they may make it difficult for you to accept what I have to say. In my experience, it seems that most of us tend to think that assessing and processing information is largely an objective experience or a mental exercise. In theory, it should be relatively straightforward. Something is either true or it is not. I would suggest to you that it is actually more complicated than that. What you believe to be true will be based on many other factors besides the information itself, such as who the messenger is. Are they someone that you trust or don't trust? How is the information being presented or communicated to you? Is the speaker confident or apologetic? What is your emotional response to the information? How does it make you feel? Do you get angry or afraid as you take the information in? There are many factors, many more that I could mention, but hopefully you get the idea. How you feel about the information and its context is very important. And I say this because the whole topic of COVID-19 is charged with emotion. Some are fearful that they will get sick and die. Others are angry because they're being coerced to be vaccinated or locked down. While others, they're just simply afraid. Once again, I think you get the idea. As a result of this charged environment, I believe some key information is being overlooked. It's being too easily dismissed. What I'm suggesting to you is that you may not be able to hear what I have to say because of the emotional noise that surrounds COVID-19. But there are still other things to consider. Some of you will just be tired of trying to work it all out. You just don't want to try again. Many of you will feel that now that we have vaccines, everything will be okay. So why bother with new information? Others, mostly in the medical field, are so afraid of people following bad advice that they quickly dismiss alternative options. And of course, our government, especially here in my home state of Victoria, are convinced they already have a plan, especially now that we have the vaccines. Never mind the extraordinary lengths that our government has gone to in order to get people vaccinated. But I'll touch on that again later. So what I am asking you to try and do, if possible, is to put all of that aside. And I know it's a big ask, and for some it may just not be possible. But please, just give me half an hour, maybe 3/4 of an hour, to explore a different way of looking at this whole situation. I promise you, I'm not trying to manipulate you to say or do or think anything. All I want is for you to listen to what I have to say and make up your own mind. You're welcome to prove me wrong. I've been wrong before, I'll be wrong again. And I'll happily apologise. Okay, so after all that introduction, if you are still with me, I'd like to tell you 2 stories. I'd like to take you on a journey to try and help you experience the pandemic from a couple of different perspectives. Okay, first up, I would like to take you to sunny Yepes in Toledo, Spain, to a nursing home with 84 patients right near the beginning of the pandemic. It's around March or April 2020. You're part of a team that is caring for these elderly patients with an average age of 85. At the time, there's limited knowledge about the virus, but you do think, you know, it's serious and very contagious. You also know that the local health system is struggling to cope, and many, many people are dying. So, knowing that you are in a high-risk situation with very limited options available to you, you, with your team, decide that you are going to develop your own clinical guidelines for the management of patients with COVID-19. You base these guidelines on your previous clinical experience in the management of severe respiratory infections, especially in patients with underlying risk pathologies. One of the primary drugs that you choose to use are antihistamines, because you are very familiar with them as they are used extensively in your area due to the prevalence of winter and spring allergies. You also know from experience that they have a good safety profile without adverse effects, even when dosages are increased up to 4 times the standard dose. You also choose to include some antibiotics that you are familiar with and that you know also have a good safety profile. They've proven effective in treating respiratory infections before. You decide to make it a priority to treat patients early, regardless of the severity of their symptoms. And you train and educate patients and carers, giving them clear instructions around self-isolating and even respiratory exercises for the patients. You even decide to give carers antihistamines as a preventative measure. Before you start, so you haven't even begun your treatment protocol, it's mid-April, you've already lost 6 patients due to COVID-19. You're now responsible to help provide care for the remaining 84 patients across 2 nursing homes. At the same time, you have to protect and care for 64 staff. And so, you get to it. Over the next month and a half, 25 patients develop symptoms. So you isolate them in rooms, in their own rooms, and you treat them with antihistamines and whatever antibiotics you think are appropriate. The other 59 asymptomatic residents are treated prophylactically before anything happens, only with antihistamines. You also prescribe antihistamines to your caregivers prophylactically. By the beginning of June, all of your patients have recovered. None have had any adverse side effects, no one required hospitalisation, and there were no further deaths. At the end of June 2020, 100% of the residents and almost half the workers had positive serology for COVID-19. When compared with the average number of deaths in other Spanish nursing homes, you should have had 25 deaths. You had none. And the only medications that you used were antihistamines and antibiotics that you're already familiar with. All I can say to you is well done. Is this just a story? Am I making this up? Well, no. The story that I've just told you comes from a detailed report published in the Pulmonary Pharmacology and Therapeutics Journal in January this year. It's available for anyone to access online. Those who host the journal have made all of their COVID resources available for you to peruse. Okay, so if you have survived that story, I would like to continue the journey, and we're going to make another stop. This time, we're going to head to Port Edward. It's a small resort town on the south coast of KZN province in South Africa. Apparently, KZN is known as the Garden Province, and Port Edward, it looks lovely. It's a popular destination for tourists and holidaymakers. I think that you will like it there. However, as idyllic as this area is, COVID has arrived there too. A local doctor by the name of Shankara Chetty is taking the pandemic very seriously. And he's intent on trying to understand what is really going on. He believes strongly in education and reassures his very anxious community that he's not going anywhere and that he will do his best to help them throughout the pandemic. He even sets up a large tent at his home for those who want to come and see him. When he first encounters some of the more serious effects of COVID in his patients, he treats them as he believed initially. And I understand this includes steroids and some other medications. And these patients do improve over a period of about 2 to 3 days. But Dr. Chetty feels that he has seen these symptoms before and that they look more like an allergic reaction than viral symptoms. And so, after treating about 5 patients with steroids, he decides to add an antihistamine to see what would happen. And the results were remarkable. Patients started recovering almost immediately, as you would expect when you treat an allergic reaction appropriately. As time went on, Dr. Chetty observes that there is a distinct pattern here. Patients who come to him with viral symptoms initially would generally recover. They would then go back to work. They would play sport, etc. But then routinely, some patients, not all, some patients, on the 8th day would suddenly get worse. And in the first wave, this would present as breathlessness. So Dr. Chetty begins to educate his patients and to get the word out into the wider community. From the moment that they felt that they were sick, they were to record the date and then come and see him. He would treat their symptoms as you would treat the flu. He also began to teach them that there was a possibility that around the 8th day, they might suddenly get worse. And if they did, that they should come and see him right away. Later, he even gave them a script just in case the 8th day fell on a Sunday and they couldn't get access to him quickly enough. What Dr. Chetty found was that if the patient developed the allergic symptoms, took the steroids and the antihistamines immediately, then they recovered quickly. If he waited, however, if they waited longer, their symptoms rapidly got worse and they were far more difficult to treat. I would now like you to hear about this unique approach to the treatment of COVID-19 from the man himself. I've taken a liberty. I've taken this footage from an interview on YouTube conducted by Dr. Philip McMillan with Dr. Shankara Chetty earlier this year on April 25th. This is an excellent interview. It's easy to find online, and I recommend that you watch the whole thing. It goes for about an hour. At the time, Dr Chetty had already treated over 4,000 patients with no hospitalisations and no need for oxygen and no deaths from COVID-19.
On that 8th day, I started treating patients with prednisone. We have a paucity of facility to do blood tests and to clarify what you are actually seeing. So I had to use clinical improvement as a measure of efficacy. So I started patients on steroids, and I found it took 2 or 3 days for them to improve, and all of them got better. And so I noticed that steroids seemed to have the benefit, like it was reported around the world, the reason for me looking at steroids as my first choice. And then one fateful patient came in with a saturation of 80 odd, very dyspneic, a very young patient, overweight, diabetic. And I knew I had to give her the steroid. And I looked at her and I thought, if this is a type 1 hypersensitivity because of its speed of onset, then maybe I need to add a strong antihistamine like I would a bee sting. So I gave her a kiddie's dose of promethazine just for a day to see what would happen. And I got my staff to follow up on almost every patient on a daily basis just to see how they improved. Because obviously the clinical side of things was vitally important in me fine-tuning how I treat them. And this particular patient, by the next day, was perfectly fine. And so my staff were very excited and came to me and said, hey, she's perfectly fine. And I said, just watch and see. I only gave her a day of antihistamines. And as that wears off, she probably will get breathless again. And that's exactly what happened. But she timeously came in as soon as that happened, and we continued a dose of antihistamines, and she promptly recovered. Since then, I've seen many of those immediate recoveries. And so it drew my attention to a sudden onset allergic process.
So hold on there. So you were finding that use of antihistamines, simple antihistamines, were beneficial once they started to become short of breath?
Yes, very beneficial. If I have to, a case in point, Philip, I've treated a lot of patients over the phone. I'm from South Africa, so I have lots of friends and family around. I had a gentleman, a 54-year-old gentleman, who's diabetic and hypertensive, and had a double stent put in 2 months prior. He's not my patient. He lives in my hometown, and he's friends with family. And his daughter phoned me to say, Dad's got COVID. And I explained to her about the onset, and I said, look, next week, Wednesday, is his day to have this kind of reaction. Please keep me posted. I need to respond immediately. She contacted me on Friday, 2 days after this had started, very frantically asking me to please give her a script for oxygen. So when I inquired why, it transpired that her dad started experiencing breathlessness on Wednesday, like I had predicted. By Thursday, it had developed to the point where he had become oxygen dependent. He had spent Thursday night on the oxygen, could not take his mask off because his sats kept dropping. They were prepared with the pulse oximeter and the rest. On Friday morning, the oxygen was running out, and so she frantically phoned me. I subsequently sent her a script to say, look, I don't see the need for oxygen. I sent him a script for a stat dose of 12 prednisone and a 25 milligrams promethazine to continue with. She got to him at lunchtime. His cardiologist had already made arrangements for a hospital bed for him. He was sitting there with his bags packed, contemplating his fate, because obviously when patients go to hospital, they never get to see their families again unless they come out recovered. And his daughter had pitched up with this handful of pills. He took it. I phoned the next morning, being Saturday morning, to find out how he was doing. He had not needed the oxygen through the evening. Within an hour or two of taking the medication, he had shown improvement. He managed through the evening without oxygen. So I got his telephone number from his daughter. I phoned again on Sunday morning to find out whether the improvement is continuing. And his wife told me that he's outside washing the car.
Wow.
So I could not ignore that. And the reason I'm here today is not because I did any research or anything down in this field. The progress I saw with my patients was remarkable. We could not ignore it. My staff and a few pastors in the area that I had treated forced me to make this information available.
Dr. Chetty has now been caring for people who have come down with COVID-19 for over 18 months. He has seen over 7,000 patients, still with no hospitalisations, no need for oxygen, and no death. There are other video interviews available on YouTube where he very patiently and carefully gives all the details. I recommend that you check out all those interviews. But how is this possible? Is he really dealing with the same coronavirus that we have been told about? I first heard Dr. Chetty's story on the 23rd of October, which is only a week ago. For my wife and I, suddenly the penny dropped. We had an aha moment. I can only describe it as everything suddenly made sense. Everything seemed to just line up. It was what I would call a red pill moment like no other. You see, like many people, I have been following the virus since it began. And the thing that I just couldn't get my head around was what was causing the inflammation. I even looked into biotech companies that were focused on this phenomena. Everyone had a theory, but no one had a real viable answer. And here was a doctor in rural South Africa that was able to demonstrate repeatedly that we are actually dealing with two different pathologies, not one. The first is a virus, much like the flu, which most of us would be very familiar with. But there was something left behind after patients had recovered, that some started having a reaction to on or around the 8th day. And for me, this changed everything. So why is it that most of us have never heard of the experience in the nursing home or of Dr. Chetty? Could there really be a simple treatment regime that has been overlooked? It's hard to get your head around. Think of all of the unnecessary deaths if that is the case, not to mention the physical and emotional suffering that could have been avoided. I realise that for most of us, this would be an almost impossible concept to accept. The implications are just too far-reaching. It's just too hard to even consider. But you see, therein lies the problem. It's precisely for that reason that these accounts continue to be ignored or overlooked, because they don't line up with what we have collectively come to believe about COVID-19. And the implications, if they are true, for many of us, are too shocking to believe. Now, I'm not, in saying any of this, having a go at people. I think generally people have done their best. All I am saying is that there is information here that could be vitally important to all of us that we need to consider, despite our past experience for the last 18 months. Now, is this then a giant conspiracy? Is there a worldwide plot to sell us expensive vaccines or to reduce our population? And you know that these theories and more are out there. Most of you would have heard at least one or two of them by now. I can see how these kinds of theories do develop. How else do you explain the disconnect between these stories that I've just shared with you and the narrative surrounding COVID-19 that we've been given? Well, I suggest to you today that I don't think this is the case. While there may be hidden agendas out there, I don't believe that there's a widespread conspiracy. I say this because the simple fact is that all of this has happened before throughout history. And unfortunately, it will probably happen again. You see, there is an aspect of human nature that we all share to some degree. We all develop an understanding of what we think is going on. Let's call it a narrative. And there are plenty of people, including me today, who want to build and inform that narrative for you. But once it's in place, it can be very difficult to let go of. Let me give you some examples. Have you ever heard of Sister Elizabeth Kenny? She was a self-trained Aussie bush nurse who lived from 1880 to 1952. She lived through a period where polio was a huge issue, but she developed a treatment that helped polio patients recover with fewer after effects than those that were treated in the usual way. Standard practice was to put the affected limbs in a plaster cast or a brace. Her approach was to apply a hot compress to the area, followed by passive movement to reduce what she called spasms. For her treatment to work, though, she needed to access and treat patients early. She needed to get them when they were in the acute stage of the disease, but she was refused early access and was only allowed to treat patients after the tightness and the spasm stage. So she went at it alone. And she basically proved them all wrong. She managed to find a patient that she could treat in the acute stage, and that patient recovered just as Kenny had hoped. She went on to write books, to travel the world to get the message out there. It took a very long time, and her results and methods were questioned and publicly criticised by various doctors and medical boards for many years. It's a fascinating story, and they even made a movie about her in 1946 called Sister Kenny. Even though she was resisted by those in authority, she was eventually able to get enough people to see that she was onto something, and her treatment became widely accepted. So accepted, in fact, that her treatment method has now become the basis for what we know as physical therapy or physiotherapy. Okay, I'll give you another example. Have you ever heard of Dr. Barry Marshall and Dr. Robin Warren? They are two Aussies that discovered that stomach ulcers were caused by a certain bacteria. They were ridiculed for years, even though they could show that patients with ulcers can be treated with antibiotics. And unlike patients that have been given acid-suppressing drugs of the day, their ulcers did not return. But gastroenterologists resisted the idea. I read a quote from Francis McGrath, and he remembers attending the 1988 meeting of the American Gastroenterological Association in New Orleans. He heard outraged physicians. He said they seemed insulted, saying, "We are being asked to treat stomach ulcers with antibiotics, as if it were gonorrhea." It was hard for them to accept that the disease could just be a simple infection. Also, drug companies that obviously profited from the anti-ulcer drug market were also actively resistant. Even some bacteriologists were suspicious because the stomach had long been assumed too acidic to host bacteria. So in frustration, Dr. Marshall conducted an experiment on himself. He digested the bacteria and then developed the sort of gastritis that leads to ulcers. He then went on to successfully treat himself. My colleagues were alarmed, he recalled, and so was my wife. And I can understand why. But after many years of fighting against opposition from those who, again, should have been open to new ideas, people with years of study and practice, who should have been motivated to try whatever it takes to help treat people who suffered from stomach ulcers. Finally, people began to accept what these doctors were saying, and their treatment has become the accepted practice for treating most gastric ulcers. So much so that in 2005, both men received a Nobel Prize for their discovery. I share these stories to try and show you that this phenomenon is not new. I don't understand why this is so. Why is it that even people who have spent their lives studying to try to help people with specific maladies can be so closed to alternatives, even when their success can be repeatedly demonstrated? I just don't understand. All I know is this: it is a pattern that repeats itself over and over again. So I wonder, is this same pattern repeating now with COVID-19? I think it's a distinct possibility. Based on what has gone on throughout history, it is quite possible that the accounts of successful alternative treatments to COVID-19 have been largely ignored and overlooked. As I've shown already, this kind of thing has happened before. And I actually think that to call it a conspiracy is to shirk the issue. You may not like to hear this, but I believe we all, to some degree, have to take responsibility for our own prejudices or pride or whatever else prevents us from at least considering an alternative narrative or opinion. It is just too easy to assume that we already know and to immediately dismiss other opinions. But we might touch on that again later too. Okay, let me try and bring this all home. Thank you so much for hanging in there. If this is not as simple as separating what we think of COVID into two separate pathologies, as I've described previously, if it is not as simple as treating the second pathology as an allergic reaction, then I would really like to know. Because this understanding of COVID makes the virus far more manageable. And if it's not as straightforward as I'm presenting to you, then how do we make sense of Dr. Chetty's success or the success in Spain? The obvious question is, what is causing the allergic reaction? Well, Dr. Chetty has a theory. It is his belief that the coronavirus leaves behind a remnant, probably of the spike protein. And it is this that some patients are reacting to. I am not a doctor, as I said before, and I don't know if this is the case, but it is hard to argue with the results. And whether it is the spike protein or some other remnant, does it really matter at this point? Do we really need to know all of this before we test out Dr. Chetty's program for ourselves? The medications that Dr. Chetty is using successfully to treat COVID-19 are well known. They are readily available and they are inexpensive. And as stated in the Spanish study, antihistamines in particular are well-known medications with a very high safety profile. The alternative is that we just keep on doing what we're doing. There are variations, but in general, we are relying on various social distancing measures, as well as other social controls, and ultimately vaccines, new vaccines, to protect our populations. As I understand that logic, and as I said before, I'm not anti-vaccine per se. However, these measures are disruptive to say the least. They are very costly, and for some, they are traumatic and abusive. We are inflicting damage on some of our citizens that will last them for a very long time. And despite the constant and confident statements by our own state premier that these vaccines are safe, the simple fact is that they are not totally safe. There are known risks, and every one of us who has been vaccinated has had to listen to and consent to that whole list before. And in fact, when I went to my second one, the list had got even longer, and it included a whole section on heart conditions. Even I at the time could see the irony. But now, in light of Dr. Chetty's experience, we face the very real possibility that the vaccines that we have placed so much hope in are actually a greater risk to our health than the virus itself. In fact, if Dr. Chetty is correct, then the problem all along has not been COVID-19, as it turns out. It can be quite easily managed, with no side effects and no death. The problem has been in our response to it. I live in Melbourne, Victoria. You know, allegedly, we are the most locked down city in the world. People are leaving our state in record numbers. I read a report the other day that stated Victoria is the only state in Australia to record a drop in population during the pandemic. A growing number of people just don't want to live here anymore. Our particular state government has been very aggressive in trying to deal with COVID. In the early days, their response made sense to me. We didn't know much about the virus and we needed to limit its spread. But more recently, their initiatives, restrictions and mandates have been making less and less sense to me. It also seems that the harder they push, the less impact they are having. Case numbers are still high, as are hospitalisations, and people are still dying. Last weekend was a big one for my wife and I. As I said, on Saturday the 23rd of October, we watched for the first time as Dr. Chetty explained his approach to treating COVID-19. I was so impacted by what I was hearing that I went on to watch 2 more hour-long videos where he shared his story again, just so that I could soak up everything that I could of his story. I admired his patient, thorough approach and his success. And then, on the very next day, I heard our Premier announce that our economy was opening up, but only to those who are vaccinated. I could not believe what I was hearing. Those who have chosen not to be vaccinated are to be effectively locked out of all but essential services for well into 2022. It was a bizarre experience. To go from the highs of hearing of Dr. Chetty's success to the lows of realising that where I live in my own hometown, thousands of people are about to be made virtually second-class citizens and locked out of all but essential services for who knows how long. And I was now of the opinion that it was increasingly likely that this was totally unnecessary. I have not stopped thinking about this all week. I have been reading and emailing and writing virtually non-stop. And I'm yet to find any evidence that what Dr. Chetty is doing does not work. In fact, I'm finding the opposite. This whole experience reminded me of what I'd been told about the philosophical principle known as Occam's razor. It had always been presented to me that this was about giving priority to simplicity. I've heard it quoted as the simplest explanation is usually the best one. However, when I looked into it, I found that this is not really what he was saying. And what he was saying didn't really apply to what I'm speaking to you about today. But while I was reading, I stumbled across an American saying that does seem appropriate. The saying is this: when you hear hoofbeats behind you, don't expect to see a zebra. Now remember that this is an American saying and there are not many zebras in America. So you're unlikely to see one. Apparently, in medicine there can be a tendency to be predisposed to a more exotic diagnosis. And so I wonder, is this somehow an issue that needs to be added into the mix? Have we been on the lookout for a pandemic for so long that when it comes and presents with severe symptoms, we somehow lean to a more exotic explanation? I don't really know. I am just trying to understand how we can largely ignore, for 18 months, such a successful treatment. In my home state, there's been lots of messaging around COVID-19. If you have symptoms, get tested. If you have any exposure, get tested. If you test positive or are awaiting a test, then self-isolate. This virus does not discriminate. I've heard that one quite a lot. Get vaccinated for the sake of your friends and your family. I can recite most of them. But until the other day, I had not heard or read a specific statement from my government that explained that there could be a severe change in symptoms between the day 5 and day 10. I have no doubt that it's been discussed. My point is simply this: I am far more aware of the other general messaging, the kind that amps you up, gets you anxious and afraid. Can you see how this might be a problem? Contrast that with Dr. Chetty's approach, where he has educated his community about how the sickness progresses and what they can expect to see. One approach gets people anxious and on edge. The other calms them down and helps them to get on with their lives. No wonder we are largely surrounded by chaos. We have been fed fear for over 18 months. Remember when I spoke earlier about the importance of understanding the role of a narrative of what we believe to be true? Well, here is where it gets really scary. And again, I remind you, this is not a conspiracy theory. This is just how it works. You see, one of the areas that a narrative is most powerful is in the area of leadership. It makes sense. To lead people, you have to have some idea of where you are going. You cannot effectively lead others if you are conflicted or in doubt or uncertain. So when you have a strong leader, you can almost guarantee that they have a strong sense of story, a strong sense that what they are doing is the right thing. But can you see the problem? What if they are leading out of the wrong story or an inferior story? It can be difficult at the best of times to get an average person to consider a different perspective. So can you imagine how difficult it can be to get a strong and determined leader to consider that they might be wrong? And that's exactly what I think is happening all around the world, but especially here in Victoria. I'm sorry, I'm not into character assassination. I chose a long time ago to love and respect everyone to the best of my ability, to give everybody the benefit of the doubt. But at some point, you have to evaluate behaviour. And it seems clear to me that our Premier, the leader of our state, is being a bully. I don't say this lightly. I don't say this to call him names. I am simply describing a behaviour. And he's not the only one. And I use this term deliberately, as I said, reluctantly, because I think that it's the best term that describes the form of leadership that uses the law and political power in such a way that you effectively silence other opinions and options, and you force and coerce people to do what you want them to do. You know what's the most scary? Is that we have here in Victoria a Premier who is currently, right now, in the process of instituting policy that will give him even more power. It is madness. And it does my head in. It also makes me question every other decision that he and his government have ever made. When they say that they have consulted widely and considered other options, how can I believe them? I have no confidence that they even know how to do this. So why bring all this before you? Why do I feel the need to speak publicly about it? I am nobody. As I said, I'm not a doctor, not a politician. I'm not a leader of anything. So in our culture, I don't really have the authority to speak up. So why do it? It's only been a week, and already people have told me that it is virtually impossible to change the current narrative. Others I've spoken who have just felt it's too hard to even consider. They just want to take the vaccine and get on with their lives. Still others, while trying to understand, struggle to see what it is that I'm getting at, to see what I see. So maybe I am delusional. Maybe I too am overreacting. I honestly don't know. But what I think I know is this. All around the world for the last 18 months or so, we have seen record numbers of people sick and dying from COVID-19. Our hospitals at times have been overrun. Our government debt has been increasing dramatically. People have been locked down in their homes for long periods of time. Businesses have been forced to close, some of which may never open again. We've had riots and protests around the world as our freedoms have been eroded and as many people are being coerced into receiving a vaccine against their will. Meanwhile, in a small, maybe insignificant part of the world, a humble rural doctor has been successfully treating COVID-19 patients without a single death, without any of the hoopla that we are faced with. How can these two stories coexist? Well, I'm hoping that they cannot. I'm here to say that enough is enough. It's time to sit up and take notice of what Dr. Chetty is doing. It's time to consider an alternative narrative, a different way of understanding and treating COVID-19. As I said, enough is enough. To quote Bob Dylan, yes, and how many years can a mountain exist before it is washed in the sea? Yes, and how many years can some people exist before they're allowed to be free? Yes, and how many times can a man turn his head and pretend that he just doesn't see? The answer, my friend, is blown in the wind. The answer is blown in the wind. Yes, and how many times can a man look up before he can see the sky? Yes, and how many ears must one man have before he can hear people cry? Yes, and how many deaths will it take till he knows that too many people have died? The answer, my friend, is blown in the wind. The answer is blown in the wind. Well, the answer may be beyond us. It may be blown in the wind. It may be impossible to change the narrative, but I am going to try. You see, I believe that we can do something. You've made a first step just by listening to what I have to say. But we can do more. Firstly, I would like you really to think about what I've shared with you. Watch the video again if that helps. And then if this strikes a chord with you and you think that it's worth further investigation, then watch the Dr. Chetty interviews that I've mentioned above. But understand, the only people who seem to be open to what these people have to say are the ones who are generally open to everything. So you'll no doubt come across things, some very interesting points of view. Please don't let that put you off. Also, please understand I'm not encouraging anyone to go off and treat themselves with whatever they find talked about on the internet. I value the medical profession very highly, and I'm so grateful for what they do. What I am hoping is that across the board, there is a realisation that there really is a better way to treat COVID-19. Dr. Chetty is a doctor and a scientist. He's not been treating people without valid medical reasons. He's been following a scientific process. He describes this in detail and how he developed his treatment protocols as well as the medications that he uses. Well, there may not be much information out there. There is some. And I realise that Dr. Chetty is probably not the only one. I'm sure there are other incredible examples of doctors in other parts of the world who have also had success in dealing with COVID. I've just not heard of them. Secondly, I would like you, if you think there's validity in this, to just tell people, to get the word out there. We have an amazing technology that allows a technology platform that allows us to share information at a rapid rate around the globe. Tell your family, tell your friends, tell your neighbours, tell anyone who will listen. That's what I'm doing. Don't harass them. It doesn't help to apply pressure. It just creates more problems. Let the power of the message speak for itself. And that's it. What I'm hoping is that as soon as possible, enough people will see value in what Dr. Chetty is doing to investigate it further. Many of you who are watching this video live in a democracy. On a regular basis, we get to decide who leads us. Do you really want our governments to just keep on doing what they are doing? They listen to public opinion. What we collectively believe is very powerful. In a sense, I'm calling for an intervention. I'm calling for concerned friends, family, and medical professionals, anyone who can see that the current response to the COVID-19 pandemic is causing unnecessary harm, to speak up and to say with me, enough is enough. There is a better way. I know it's hard to believe with all our resources that we could miss a fundamental piece of the puzzle, but I think that's exactly what's happened. And it's happened throughout history. This is not the first time. Unfortunately, people are hearing hoofbeats, but they are looking for zebras and they cannot see the horses that are running directly toward them. So if you're a doctor, please investigate further. If you're in the media, please investigate further. If you're a politician, please investigate further, because the truth may well be coming. And you do not want to be on the wrong side of it. Thank you so much for taking the time to listen to me. I really do appreciate it. If I'm wrong, so be it. If this all turns out to be a hoax and a fantasy, then so be it. What is there to lose? It is worth the risk. This has to be investigated further. You can obviously make your own decision, but as for me, I cannot and will not remain silent. This has gone on long enough. Surely by now, enough is enough.